From the Gulf States newsroom, this is the Gulf States Gumbo. I'm public health reporter Drew Hawkins, and in this episode, we'll be doing something a little different, focusing on a single story. Over the last year, I've been reporting on the impacts of a shortage of a special group of nurses, and we'll learn more about who they are, what they do, and how they help survivors of sexual assault. But before we get into it, a warning for listeners. This episode does contain descriptions of sexual violence that may be upsetting for some. On the night of December 28, 2016, Julie Ford put on her shoes, grabbed her iPod, and went out for a run along the top of the levee in her neighborhood in New Orleans. It was something she did often, a few times a week.
It was the same route. It was like, I always would do like a 30-minute, 2.5, 3 miles, something like that. It was always kind of the same route.
It was a little after 8 p.m., so it was dark out. She could hear music and noise coming from a neighborhood bar, but there were only a few people out on the levee.
I would say it was like one of those weird, cloudy, kind of foggy, yucky weather.
As she was nearing the end of her run, Julie noticed someone sitting on one of the benches in front of her, but she didn't think anything of it.
It's never weird to see somebody sitting on those benches either, because people were always just like watching the boats, that time of night.
As Julie passed a man sitting on the bench, it happened quickly.
He just like tackled me like a football tackle.
Julie doesn't remember everything about her assault.
It's still in these little snapshots, and I'm not really sure what order they go in.
She remembers being pulled down the levee. She remembers trying to fight him off. She remembers being hurt, badly, and dragging herself through the dirt, calling for help. Her husband, neighbors, and EMTs carrying her broken body to the ambulance, which couldn't get to her on the riverside of the levee. One thing she does remember is pleading to be taken to West Jefferson Medical Center, a hospital not too far away, and one she knew was in her medical insurance's network. She didn't know it yet, but her hip had been badly dislocated, her nose was broken, and her arm broken so badly, EMTs later described it as being in the shape of a question mark. But because she'd been sexually assaulted, she says she was told she had to be taken to University Medical Center across town, or UMC as it's known.
Because you have to get a forensic medical exam, and that's the place that we have to bring you to. It wasn't like, oh, it's a level 1 trauma center, your traumas are so bad, you have to go there. It was like, you need to go there for the forensic medical exam.
UMC has sexual assault nurse examiners on staff, or SANEs. Most hospitals in the country don't. These are specialized nurses who provide trauma-informed care as they conduct forensic exams, collecting evidence for a sexual assault forensic exam kit, what's sometimes called a rape kit. SANEs also connect survivors with advocates who play a vital role for survivors, both in their own healing and in their legal outcomes. For Julie, getting to the hospital was another blur. She felt alone. She was scared. And then she met an advocate from Sexual Trauma Awareness and Response, or STAR.
So I remember the first time I felt like, oh good, somebody's like here to help me, is when I met the advocate from STAR.
STAR is an advocacy group that works with survivors of sexual assault. Part of that work includes sending volunteers to hospitals to sit with patients like Julie while a SANE conducts a forensic exam, collecting evidence that could be used in prosecution.
I don't know, she was just quiet and she was sitting there, and it made me feel like much better just to have her there.
Julie wasn't charged for the forensic exam. In Louisiana, hospitals are reimbursed by the state's Crime Victims Reparation Fund. But that only covers the forensic exam, not medical bills related to other injuries. She says she was charged about $20,000 for her medical care at UMC, and her injuries still haven't fully healed. She and her husband spent months making phone calls to their insurance company. She broke down in tears, having to retell the story of what happened to her over and over. Eventually, they were able to get the bills down to about $2,400. She says after a lengthy application process, these bills were eventually reimbursed through the Crime Victims Reparations Fund, a process Julie learned about from STAR.
the only thing in the system that I think worked in my entire experience was that, that piece, the forensic medical exam and the advocate piece. Like, I felt very lucky to have that because the rest of it was frankly like a complete disaster,
So who are these SANEs? These nurses who make the choice to do some of the most difficult and demanding work? Well, a good place to start would be how a nurse becomes a SANE.
Good morning. Good morning. Thank y'all for being here.
Shalata Sharp is a certified SANE and one of the instructors at a training in Meridian, Mississippi. A group of 7 nurses and nurses in training from across the region are sitting around tables sipping coffee. They're here for a week-long course to become SANEs. This is day 1.
How many of you learned about the SANE program or SANE nursing or forensic nursing in nursing school?
Not a single hand goes up.
Me either. So forensic nursing is the best kept secret in the nursing community, in my opinion.
Sharp is with the Mississippi Coalition Against Sexual Assault. It's an organization that puts on free courses like this one, hoping to get more nurses trained and certified. Nurses are very busy people, and with a shortage of working nurses, many of them are even busier. Sharp says it can be tough for them to get time off or pay for extra classes.
Our goal is that nurses are educated on this episode of care and utilize that in their practice.
Sharp says the vast majority of sexual assaults that are reported don't lead to a conviction. A forensic exam from a SANE could improve the chances of prosecution. But there's a critical shortage of these nurses. Alabama only has 44 certified SANEs for the entire state. Louisiana, 42. Mississippi has 6, for a population of almost 3 million. Sharp is here in Meridian to try and boost that number. She says any nurse can do a forensic exam.
If you can operate a Q-tip, then you know how to do the kit.
Throughout the course, the nurses learn everything from exam and interview techniques to working with vulnerable populations like human trafficking survivors. That's what makes SANEs special. It's the holistic, trauma-informed care they learn and then provide sexual assault patients, addressing both physical and emotional needs.
So the first thing that you do when you come into the courtroom is you're going to come to the witness stand. If I'm trying the case, I'm going to direct you to the witness stand.
They also take part in a mock trial in a real courtroom with real lawyers, because SANEs can also be qualified as experts and testify in court.
All ready?
None of the nurses are looking forward to this.
The SACO's Jenny Cochran.
Nurse Jenny Cochran makes her way to the stand, and an assistant DA questions her just like they would in a real trial.
Ms. Cochran, what color were these bruises that you observed?
Reddish blue.
And then comes the cross-examination, with another DA posing as a defense lawyer.
You weren't there when it happened, is that right?
Yes.
You saw nothing?
Right.
This part can feel intimidating. Shalata Sharp, the trainer, says the fear of potentially having to testify in court is what keeps some nurses from becoming SANEs in the first place. Cochran gets some feedback from the pretend judge, another DA, and it's over.
Trust me, this is the part I was the most scared of.
Well, you did great. And if you want to ask...
All of these nurses volunteered for this training, and for different reasons. For Jenny Cochran, who you heard on the witness stand in the mock trial, it's personal.
So why am I taking this course? This course is actually near and dear to my heart. My daughter was actually raped at the age of 13, and it changed her life. She started cutting. I'm sorry. So I'm getting emotional. So this is near and dear to my heart, and I would like to be an advocate for those that don't have a voice. So, and make sure it's done right so they can't throw it out of court.
Other nurses say they came to the training because they don't have any SANEs at their hospital, like Jane Cohn, a nurse who drove in from Alabama.
I work in small hospitals, and we don't have that in our small counties, so I just wanted to try to do it. That's all.
Cohn says whenever a sexual assault patient comes in, if they want a forensic exam, her hospital tells the patient they can't do it, and they transfer them across state lines to another hospital in Mississippi.
We just send them over here because we really don't have the staff to do it. It's the biggest thing.
Cohn wasn't the only one to say this. Nurses, advocates, and legal experts across the Gulf South say sometimes patients can't access forensic exams at their local hospital. Instead, they're sent somewhere else. That could be across town, across the state, or even over state lines. In some cases, survivors end up driving themselves. It isn't clear how often patients have to travel to get this care. None of these states track how often this happens. And if someone is assaulted and they go to a hospital that doesn't have a SANE, there's no way to know how many are told they have to go somewhere else. This isn't just bad for their well-being. It could also impact their legal outcomes. Here's Naomi Jones, a former prosecutor in New Orleans who actually worked on Julie Ford's case.
Imagine it being brutalized and then prodded in a medical facility, transported over state lines or across parish lines, how many different strangers you're going to have to interact with. When a lot of times after that kind of trauma, people just want to go home and sit in the dark by themselves.
Jones says in addition to providing trauma-informed care for survivors, SANEs are better at what's called the chain of custody, which is the process by which evidence is collected and then transported so it's not damaged or contaminated.
Chain of custody is incredibly important, and they're trained to do it, and they're good at it. They're good at it. And the forensic nurses that I know can do it in their sleep. They're very good at it. And that helps preserve the evidence, and the evidence helps find the truth.
When a prosecutor is making a decision about going forward with a sexual assault case, part of that process includes looking at whether or not there's enough evidence, including whether or not there's been a forensic exam.
It absolutely makes for a stronger case against a defendant when you have medical evidence. It absolutely makes a difference, a massive difference.
It made a difference in Julie Ford's case. Getting a forensic exam from a SANE was completely critical in bringing her rapist to justice almost a decade later.
Because it was collected in that way, in the correct chain of custody and very clearly labeled and all those things like that, of course, helps maintain the integrity of that, especially in a case when it's 100% of the case is reliant on that evidence. Yeah.
Since her assault, Julie has become an advocate for other survivors. She volunteers with Crime Survivors NOLA, which produces a free guidebook of resources for people dealing with the aftermath of violent crime. She didn't have a choice where she was taken, but she says if she had been told she had to go somewhere else for a forensic exam, she doesn't know if she would have done it.
Just telling somebody that they have to go somewhere else, that might be the difference between that report getting taken or not getting taken.
This episode of The Gulf States Gumbo was edited by Ashley Lisenby and Ryan Vasquez. Additional editorial support for this project was provided by Type Investigations. If you'd like to read the full story, you can find it on Type Investigations' website. Thanks for listening.